Inducing a state of a waking nightmare has been a focus in various psychological and psychiatric experiments throughout history, often tied to efforts in mind control, trauma, and manipulation of consciousness. Here are some notable examples of experiments or research programs that involved such states, alongside dates and leading individuals involved. NASHDAR 2. Donald Ewan Cameron's Psychic Driving, 1957 to 1964, date 1957 to 1964. Lead doctor, Dr. Donald Ewan Cameron, a Scottish-American psychiatrist. Purpose: Cameron was part of the MK Ultra project and conducted experiments at the Allen Memorial Institute in Canada. He used methods such as electroconvulsive therapy, ECT, at 30 to 40 times the normal power, sensory deprivation, isolation, and repeated tape-recorded messages, psychic driving, to erase and reprogram the human mind. His aim was to induce regression and create new, controllable personalities. Outcome: his methods left patients in a disoriented state, often experiencing terrifying hallucinations, severe anxiety, and sometimes complete mental breakdown, resembling a waking nightmare. Chapter 3. Stanford Prison Experiment, 1971. Date: August 14 to 20th, 1971. Lead doctor, Dr. Philip Zimbardo, a social psychologist. Purpose: this social psychology experiment placed participants in the roles of prisoners and guards in a simulated prison environment. The study quickly devolved as the guards became increasingly abusive, and the prisoners experienced extreme emotional distress, feelings of powerlessness, and in some cases, a state resembling a waking nightmare due to the psychologically traumatic conditions. Outcome: the experiment was terminated early due to the severe psychological impact on participants, who reported emotional breakdowns and trauma. Four, Milgram Experiment, 1961 to 1963. Date: 1961 to 1963. Lead doctor, Dr. Stanley Milgram, a social psychologist. Purpose: Milgram's experiment focused on obedience to authority, where participants were instructed to administer increasingly painful electric shocks to a subject who was an actor. Many participants were driven to extreme emotional stress and exhibited signs of anxiety and distress when forced to comply with orders that they believed were causing severe pain to others. Outcome: participants reported a state of extreme inner conflict and distress, some of whom experienced their actions as nightmarish due to the psychological manipulation involved. Napa 5, Sensory Deprivation Experiments by Dr. John Lilly, 1950s to 1960s. Date: 1950s to 1960s. Lead doctor, Dr. John Lilly, a neuroscientist. Purpose: Lilly's experiments involved sensory deprivation tanks, where subjects floated in isolation, cut off from external stimuli. Prolonged sensory deprivation led many subjects to experience profound alterations in consciousness, hallucinations, and a detachment from reality akin to a waking nightmare. Outcome: subjects often reported terrifying hallucinations and anxiety when isolated for extended periods, which paralleled dreamlike or nightmarish states while awake. 6. Deep sleep therapy, 1960s to 1970s. Date: primarily 1960s and 1970s. Lead doctor, Dr. Harry Bailey, an Australian psychiatrist. Purpose: deep sleep therapy involved putting patients into a medically induced coma for days or weeks and using electroconvulsive therapy to treat mental illness. It was believed that extended unconsciousness would allow the brain to reset itself. Many patients, however, experienced severe distress when awakened, with some describing their induced comas as a living nightmare. Outcome: the therapy resulted in numerous deaths, long-term psychological damage, and the experience of nightmarish confusion upon waking. 7. Sleep deprivation and torture techniques, various studies and reports. Date: throughout the 20th century, especially in the 1950s to 1970s. Lead doctors, various military and intelligence agencies, as well as civilian researchers, have studied sleep deprivation's effects, often as part of interrogation techniques. Purpose: sleep deprivation has been used as a method to break down psychological resilience, often causing hallucinations, paranoia, and a sense of reality distortion, leading to what could be described as waking nightmares. Outcome. Subjects of sleep deprivation often experience hallucinations, paranoia, and a breakdown in cognitive functions, simulating a nightmare-like existence while awake. 8. Jose Delgado's brain stimulation experiments, 1960s. Date, 1960s. Lead doctor, Dr. Jose Delgado, a Spanish neurophysiologist. Purpose: Delgado used electrical stimulation of the brain to control behavior. His experiments with electrodes implanted in the brain allowed him to evoke intense fear, anxiety, and even hallucinations in animals and humans. Outcome: these experiments were capable of inducing panic and fear that mimicked waking nightmare states, showing that certain brain regions, when stimulated, could produce terrifying experiences. Conclusion: these experiments show a disturbing pattern of research into manipulating human consciousness, often leading to states of extreme distress, hallucinations, and altered realities. Many of these experiments were ethically questionable and caused severe long-term harm to participants, often leaving them trapped in nightmarish psychological conditions.
Audiences know what to expect, and that is all they are prepared to believe in.
He was an authoritarian, ruthless, power-hungry, nervous, tense, angry man. Not very nice.
And it is his mind, no less, which may destroy mankind.